Hirschberg Test. Corneal Reflex Test. Introduction. The Hirschberg Corneal Reflex Test, also known as the Hirschberg Test or Corneal Light Reflex Test, is an objective assessment used to evaluate the alignment of the eyes and detect strabismus, particularly in young or uncooperative patients or when the physician's ability to deviate the eye is poor. It provides a rough estimation of the angle of manifest strabismus and uses the first Purkinje image to assess the eye's deviation. To perform the test, the room is dimly lit or darkened to make the light reflex more apparent. The patient sits about 50 centimeters away from the examiner. The examiner turns on a pen torch and directs the light toward the middle of the patient's nose open parenthesis midline of the eyes close parenthesis. The light reflex should appear as a small and bright spot on the cornea. The patient is instructed to look at the light. The examiner, with their eyes directly behind the pen torch, observes the corneal light reflex from both eyes. The examiner should compare the positions of the light reflexes in both eyes. The interpretation of the test results is as follows. If the light reflex is centered in each pupil, it indicates normal alignment. If the light reflex is decentered temporally open parenthesis away from the nose close parenthesis from the center of the pupil, it suggests esotropia open parenthesis inward eye deviation close parenthesis. If the light reflex is decentered nasally open parenthesis toward the nose close parenthesis from the center of the pupil, it suggests exotropia open parenthesis outward eye deviation close parenthesis. If the light reflex is decentered downward from the center of the pupil, it suggests hypertropia open parenthesis upward eye deviation close parenthesis. If the light reflex is decentered upward from the center of the pupil, it suggests hypotropia open parenthesis downward eye deviation close parenthesis. The degree of strabismus can be roughly estimated by measuring the decentration of the reflex from the center of the pupil in millimeters. 1 millimeter of deviation is roughly equal to 15 prism diopters. The estimation is between center of pupil and pupillary margin. Approximately 7 degrees of 15 prism diopters. At pupillary margin, approximately 15 degrees or 30 prism diopters. Between pupillary margin and limbus, approximately 30 degrees or 60 prism diopters. At limbus, approximately 45 degrees or 90 prism diopters. At sclera open parenthesis beyond limbus close parenthesis, more than 45 degrees or more than 90 prism diopters.